when I'm standing at the bedside and I'm just about ready to see the birth of a brand new baby, I just am in awe that I actually have the privilege to be involved in that patient's life and an experience that they're never going to forget.
And that's what I really love about nursing, is building relationships with residents and their families so that we can take care of them through, in a lot of situations, the end of their life. And that's a really special time to be taking care of somebody.
At some point in our lives, each of us will need some type of health care. And no matter what the extent of our need is, from a simple vaccination to giving birth to caring for us as seniors, the healthcare professionals who are on the front line are nurses. Nurses provide that first contact. Nurses see us through the most challenging circumstances. And nurses check up on us afterwards, making sure we are following through with the care we need. In Kent County, we are blessed with an extraordinary number of healthcare options at every level, be it a family practice or a hospital or a long-term care facility. The success of our system depends on the quality of the nurses who work here. And for over 60 years, one of the most important sources for developing talented nurses has been Grand Rapids Community College.
Actually, on our floor, there's 4 of us that graduated from GRCC this year. Me and another girl are from the same class.
I run into people that graduated from GRCC just about every day. I was interviewing a person for a supervisor position here today. And I said, give us a little, update on you, your background and such. And the first words that came out of her mouth, I graduated from Grand Rapids Community College. She went on and got her bachelor's. And now she's in a position that she can come in and interview for a leadership position. That's right now and right here. That was today. That was just before this.
GRCC has an excellent program. It's a tough program, excellent instructors, and when you graduate from CC, you come out knowing your stuff.
The Grand Rapids Community College students are generally far more confident in their skills and far more capable. They come here with a good foundation, a good understanding of nursing process. They do a good job interacting. They have good assessment skills. They have good documentation skills. So I really have not ever had any concerns about GRCC students here. My nursing staff always reports that they really like working with CC students. So that's, I think, a positive thing as well.
For 4 of the 5 years that I've been a supervisor, we have actively been looking for nurses every semester. We're looking to fill our open holes, and GRCC throughout history has been a major supplier of new nurses for Spectrum Health.
In comparison to some of the other students that I've worked with, we're more hands-on, and I find our students are always looking for more to do, looking for more to learn. We're just always out there looking for those opportunities to gain more knowledge and be a better proficient nurse. And we look forward to seeing them in our area. We had students today, and I was actually excited. And I felt that my patients were in good hands because they're very attentive.
It was demanding, but yet very positive. I think the instructors there give you what they have 100%, as long as you respectfully give them 100%. And you go to different facilities in the area, so you get to experience all parts of the healthcare community in Grand Rapids.
For much of my adult life, I was a pharmaceutical sales representative. I called on physicians and hospitals and promoted about 18 different drugs in almost a 20-year career. And financially, that position is very rewarding, very rewarding. But there was still just something missing in my whole being. My bank account was being fed, but that was just about all that was being fed. I jumped in the nursing program, and I haven't looked back since.
I think that the difference between GRCC and some of the other schools is there's such a great emphasis on the amount of clinical experience that you get, actually working hands-on with patients and building your skill base. You know, you start out with a skill set, and in your very first class you're learning how to do blood pressures and very simple skills, but then those skills get built on and you're able to build a nice skill set. And the more interaction that you have with patients and actually in the setting doing nursing, that hands-on experience just really helps you so much.
My class, when we graduated, of course we all have to take the board exam, and 99% of us passed the first time. Some of the other local schools at the time, only 76% were passing their boards. So prep-wise, they did an excellent job.
I think I have more insight just in dealing with people. It's just made me more aware of my surroundings, of people that I encounter. I feel like I'm more compassionate and I'm more understanding. I may not have experienced that situation or that particular circumstance, but I kind of feel like I can relate to what a patient is going through. I feel like you have to have a love for nursing. It has to be a calling. My heart is in it. So it's not something that I just get up and do. Every patient I feel like I'm just personally connected to for some reason.
I saw clinical students from other colleges while I was there, and I felt like I was getting a better education, that my experience was even better than what they were getting. I was really impressed by what I was learning from my instructors in the classroom and my instructors on the floors.
That's what prompted me as well to go back to CC for my RN, because of their program, because of the way the program is set up and all the background and the experience that they give you while you're in the program.
Nursing is growing in the fields that it's going into. It's getting bigger and bigger. You're finding nurses in the IT field where we never had that before, and now it's a necessity,
We are going to an electronic medical record. Well, what we've had to do is actually tailor that software to our needs here at Metro Health. And I'm on the clinical team, so I take whatever nursing does on the inpatient side and make sure that the software is adequate for our needs.
Our hospitals are going to become fuller as the baby boomers age. I think that we're going to see more and more need for nursing care and for nurses.
In the profession right now, that's what the talk is how are we able to meet the need in another 10 or 15 years when the bulk of baby boomers are coming through.
As our baby boomers age, we have a lot more people that are going to be in assisted living, retirement communities. You see them, popping up all over. You see a shortage of physicians, so you know that your nursing roles will be greatly needed, especially in rural settings. I don't think there's going to be any job shortage anytime soon. And you can see it when you go to listings on the websites for job opportunities. There's a ton of them out there, and there's something pretty much for everybody.
Every day is different. Every patient is different. I can be taking care of 2 patients at one time, and an hour later I'm taking care of 4 patients. And a half hour later I only have 1 patient, but it's the sickest one in the ER. So it's constantly changing and, always testing you.
My whole being is being fed now. I enjoy school. Getting a good grade on an exam feeds me more than any bonus check from a sales job ever could.
It really helped me. Community college helped me when I needed it most. And that's where people go to get this kind of help. And it's kind of like a door that's open to the future for people. And it provides a place for you to go and reach your goals and have dreams and have somebody guide you through so that you know where you're going and how you can reach it. And I think that's what community college is. It is that door. And it's open. And we need it to stay open.